This is our skull project presentation by Veronica, Kylie, and Devin, and our project is on the facial bones. The assigned projections for facial bones is a PA Caldwell with a 15-degree caught-at angle, Waters, a lateral facial bone, and an SMV for the arches.
For the PA Caldwell, the technical factors are a minimum SID of 40 inches. You want to use a grid, and you also want a KVP range of 70 to 85. The part position should be to rest the patient's nose and forehead against the imaging device. Tuck the chin and bring the OML perpendicular to the IR. Align MSP perpendicular to the midline of the grid or table / imaging device surface, and ensure no rotation or tilt of the head. The CR should angle a 15-degree caught-at angle to exit at the nasion, and you want to center CR to the IR.
So for the PA Caldwell facial bones, we have 6 evaluation criteria. For anatomy demonstrated, we want to see the superior orbital margins, the maxillae, the nasal septum, zygomatic bones, and the anterior nasal spine. For positioning, correct patient position / CR angulation is indicated by petrous ridges projected into the lower 1/3 of the orbits with a 15-degree caughted CR. If the inferior orbital margins are the area of interest, a 30-degree caught-at angle projects the petrous ridges below the IOMs. No rotation of cranium is indicated by equal distance from the midlateral orbital margin to the lateral cortex of the cranium, and the superior orbital fissures are symmetric, and collimation to the area of interest. For exposure, we have contrast and density are sufficient to visualize maxillary region and superior orbital margins, and sharp bony margins indicate no motion. And then here we have an x-ray of the facial bones PA Caldwell method, and we can see here we have the nasal bones, the left lacrimal bone, the left zygoma, the left maxilla, and the mandible.
Here we have a poorly positioned image on the left and a properly positioned image on the right. In the poorly positioned image, the skull is rotated to the left. It also shows asymmetry of the orbits and the mandible, showing it is not properly positioned. For the properly positioned image, the orbits are symmetrical and there is no evidence of rotation or tilt.
For the Waters projection, the technical factors include a minimum SID of 40 inches, a grid, and a KVP range of 70 to 85. The part should be positioned with an extended neck, resting the chin against the table or the upright imaging device surface. You want to adjust the head until the MML is perpendicular to the plane of the IR. The OML forms a 37-degree angle with the table or the upright imaging device surface. You want to position the MSP perpendicular to midline of grid or the table and imaging surface device. This will prevent rotation or tilting of the head. The CR should be aligned perpendicular to the IR to exit at the acanthion, and you want to center the IR to the CR.
So for the Waters projection of the facial bones, we have 5 evaluation criteria. For anatomy demonstrated, we want to see the IOMs, the maxillae, the nasal septum, the zygomatic bones, the zygomatic arches, and the anterior nasal spine. For positioning, correct neck extension demonstrates petrous ridges just inferior to the maxillary sinuses. No patient rotation exists as indicated by equal distance from the midlateral orbital margin to the lateral cortex of the cranium on each side. And for exposure, contrast and density are sufficient to visualize the maxillary region, and sharp bony margins indicate no motion. And then here we have an x-ray of the Waters projection and the anatomy demonstrated. Here we have the nasal bones, the left lacrimal bone, the left zygoma, the left zygomatic arch, the left maxilla, and the left petrous ridge.
So the poorly positioned image on the left shows rotation towards the right and the chin overextended. To create a properly positioned image, we dropped the chin and rotated the head towards the left to get the image on the right. The properly positioned image shows no rotation or tilt, and the petrous ridges are just inferior to the maxillary sinuses, as you can see here.
For the projection of the lateral facial bones, you want a minimum SID of 40 inches. You want to use a grid and a KVP range of 70 to 85. For the part position, you want to rest the lateral aspect of the head against the table or upright imaging device surface with the side of interest closest to the IR. You want to then adjust the head into a true lateral position and oblique the body as needed for the patient's comfort. You want to align the MSP parallel to the IR, align the IPL perpendicular to IR, and adjust the chin to bring IOML perpendicular to front edge of IR. You want to align the CR perpendicular to the IR, center the CR to the zygoma midway between the outer canthus and EAM, and you want to center the IR to the CR.
For the lateral facial bones, we have 7 evaluation criteria. For anatomy demonstrated, we want to see the superimposed facial bones, greater wings of the sphenoid, orbital plates, sella turcica, zygoma, and the mandible. For positioning, an accurately positioned lateral image of the facial bones demonstrates no rotation or tilt. Rotation is evident by anterior and posterior separation of the symmetric vertical bilateral structures, such as the mandibular rami and greater wings of the sphenoid. Tilt is evident by superior and inferior separation of the orbital plates, and there should be collimation to the area of interest. For exposure, contrast and density are sufficient to visualize the maxillary region, and sharp bony margins indicate no motion. And then here we have an X-ray image of the lateral facial bones. Here we have the nasal bone, the lacrimal bone, the zygoma, the maxilla, and the mandible here.
In our poorly positioned image, you can see the facial bones are not superimposed, specifically the mandible. In this area, you can see the mandible is not superimposed. And in our properly positioned image, the mandible is now superimposed, as you can see here the difference, and there's no evidence of rotation or tilt.
For our SMV projection of the arches, the technical factors should include a minimum SID of 40 inches, grid or non-gridded, KVP range of 75 to 85, and a part position of a raised chin, hyperextended neck until the IOML is parallel to the IR. Rest the head on the vertex of the skull. You want to align the MSP perpendicular to the midline of the grid or the table or upright imaging device surface, which would avoid all tilt or rotation. And for the CR, you want to align the CR perpendicular to the IR, center the IR midway between the zygomatic arches at a level 1.5 inches inferior to the mandibular symphysis, and you want to center the IR to the CR with the plane of the IR perpendicular to the IOML.
For the SMV projection for the zygomatic arches, we have 6 evaluation criteria. For anatomy demonstrated, the zygomatic arches are demonstrated laterally from each mandibular ramus. For positioning, correct IOML/CR relationship as indicated by superimposition of the mandibular symphysis on the frontal bone. No patient rotation as indicated by the zygomatic arches visualized symmetrically. And there is collimation to the area of interest. For exposure, we want sufficient contrast and density to visualize the zygomatic arches, and sharp bony margins indicate no motion. And then here we have an X-ray image of the SMV projection of the arches. Here we have the palatine bone, the right and left maxilla, the zygomatic bone, the right zygomatic arch, and the zygomatic process of the temporal bone.
For the poorly positioned image on the left, it is evident there is no symmetry on either side. There is rotation to the right and the head is tilted. The zygomatic arches, as you can see, are not symmetrical, which can be evaluated when looking at the SMV projection. The properly positioned image shows the arches symmetrical on both sides with no rotation or tilt present.